You've been blaming yourself for years. You cut the bread, you skipped dessert, you did the sit-ups, and that belly is still there. I need you to stop blaming yourself right now, because what's pushing your stomach out has nothing to do with what you ate for dinner. And in the next few minutes, I'm going to show you exactly what's actually happening inside your body and what to do about it tonight. I'm Dr. Chandler. I specialize in age-related changes in the body, specifically what happens to our internal structure after 60, that conventional medicine rarely addresses directly. According to research published in the American Journal of Obstetrics and Gynecology, over 40% of women over 60 show measurable signs of pelvic organ descent, a condition most are never told about at their annual checkup. Stay with me until the end of this video, because I'm going to share one specific technique that addresses the root cause of this, and most people have never heard of it. Here's what concerns me most about this. Every year that passes after 60, the connective tissue holding your internal organs in place loses strength. The ligaments weaken, and when those structures can no longer hold everything up, your organs begin to descend. Slowly, silently, and as they drop, they push forward. That is the belly you see in the mirror. Not fat, gravity. And the longer it goes unaddressed, the more symptoms it generates. And I don't just mean how you look. I mean how you feel every single day. Your stomach, your intestines, your colon. Under healthy conditions, they sit high and organized inside your abdominal cavity. A network of ligaments and connective tissue acts like a suspension system, holding everything lifted and in place. But after decades of gravity, after pregnancies, after years of weakening collagen, that suspension system loses its tension. The intestine descends. Doctors call this visceroptosis, organ prolapse. And once the gut drops, it has nowhere to go but forward. It presses against your abdominal wall from the inside. That is the protrusion you have been trying to crunch away. No amount of calorie restriction changes the position of an organ. That is why nothing has worked. You've been fighting the wrong battle entirely, but here is where it gets more serious than most people realize. Running through your lower abdominal cavity are the major veins that carry blood from your legs and pelvis back up to your heart. When a descended intestine sits on top of those vessels, it compresses them. Blood flow backs up. It stagnates in the lower body. Think of a garden hose with a foot pressing down on it. The water backs up behind the pressure point. Clinically, that backup produces heavy, persistent leg swelling that is worse by evening. It produces varicose veins, those twisted, bulging vessels visible under the skin of the calves and thighs. It produces hemorrhoids, which are simply varicose veins in the rectal area, driven by the same venous backup. A 2019 study in the journal Phlebology found a significant association between intra-abdominal pressure elevation and the progression of chronic venous insufficiency in older adults. That pressure elevation, in many cases, begins with organ descent. If your legs are consistently swollen by late afternoon, or if your varicose veins have been worsening for years despite compression stockings, address the organ position first. It may be the upstream cause. And the consequences don't stop at your legs. A descended intestine does not just press on blood vessels, it rests its weight directly on the bladder beneath it. That constant downward pressure on the bladder manifests in three ways most seniors know all too well. First, urinary urgency. The sudden, intense need to go that gives you very little warning. Second, nocturia. Waking 2, 3, sometimes 4 times a night to urinate, leaving you exhausted every morning. Third, stress urinary incontinence. Leaking when you cough, sneeze, laugh, or lift something. These are not signs that your bladder is broken. They are signs that your bladder is under mechanical pressure from above. The NIH's National Institute of Diabetes and Digestive and Kidney Diseases has documented the connection between increased intra-abdominal pressure and urinary symptoms in older adults, a connection that is addressable at the structural level. Before accepting that nighttime urination is simply your new normal after 60, consider whether the pressure on your bladder may be coming from above, from organ position, not from the bladder itself. Now, the symptom I find most underreported in the 60-plus population. When the intestine is displaced downward and compressed by its own weight, its function degrades. Transit slows. Food moves through your digestive tract more slowly than it should. The result is chronic constipation, difficult, infrequent bowel movements that leave you uncomfortable and bloated for days. The persistent sensation that your belly is always distended, always full of gas, always slightly uncomfortable after meals. Research published in Neurogastroenterology and Motility has documented that reduced gut motility in older adults is significantly influenced by mechanical factors, including the anatomical position of the bowel, not just diet or hydration alone. The gut that sits in the wrong position does not function like a gut in the right position, regardless of how much fiber you eat. If you have tried every dietary intervention for bloating and constipation without lasting success, this is the conversation you should be having with your doctor. A structural one, not another dietary one. Now, I want to tell you about a patient who changed how I think about all of this. Margaret was 67 when she came to see me. She had been dealing with a bloated belly for a decade. Her legs swelled every afternoon without fail. She was waking up 3 times a night. She had seen a gastroenterologist, a urologist, and a vascular specialist. Each one treated their piece. None of them connected the pieces. When I explained visceroptosis to her, that her organs had gradually descended and were creating a domino effect of symptoms, she sat quietly for a moment and said, "Why has no one ever told me this?" We started her on the repositioning technique I'm about to show you. Within 4 weeks, her morning energy had improved noticeably. Within 3 months, her leg swelling had reduced significantly. Her nighttime bathroom trips dropped from 3 to 1. Her digestion normalized. She had changed nothing else. No new medications, no new diet. One structural correction. That technique, the one I used with Margaret, is what I'm about to walk you through right now. The most effective thing you can do to begin correcting organ descent, starting tonight, is a 3-part repositioning technique. It takes less than 2 minutes, and it works on a simple mechanical principle: creating negative pressure inside the abdominal cavity that physically encourages the intestine back toward its correct anatomical position. Here are the 3 steps. Step 1. Exhale completely. Force every last bit of air out of your lungs. Do not stop halfway. Empty yourself fully until you feel the effort in your chest and ribs. Step 2. While holding that empty breath, draw your abdomen in as deeply as you can. Pull your belly button back towards your spine. You are creating a vacuum inside the abdominal cavity. That vacuum is what gently lifts the intestine upward. Hold this for as long as comfortable. Step 3. Place your fingertips flat together like a wedge at the very base of your abdomen, the pubic bone. Using slow, firm, upward pressure, drag the tissue from the pubic bone all the way up to the navel. Then release gently. Only then, inhale slowly through your nose. 2 to 3 repetitions before sleep every night. If you want faster results, add a morning session. Be consistent. The ligaments that support your organs rebuild slowly. This is a months-long process, not a weeks-long one. But the symptomatic relief begins far sooner. Most people notice something within 3 to 4 weeks. One important note: if you are currently menstruating, rest during those days. And if you have had abdominal surgery in the last month, wait until you are fully healed before beginning. After that, this technique is not only safe, it can actually help mobilize internal scar tissue and improve bowel function in post-surgical patients. I want to hear from you. How long have you been dealing with belly protrusion, bloating, or leg swelling? And how old are you? Leave it in the comments below. It helps me understand exactly where you are in this process, and it shapes the content I create for you next. You are not alone in this, and you are not broken. Your body is responding to a mechanical problem that has a mechanical solution. Now, if your digestion and belly are connected to how your heart is aging, and they are more connected than most people realize. Watch this video next. It covers the one cardiovascular warning sign after 60 that almost everyone misses until it's too late.